Hi guys, welcome to Smart PT. My name is Jonathan Reimer. This week I'm going to be talking about the anatomy and treatment of cervicogenic headache, also known as tension headache. I'm sure you've all had many clients that have come into the clinic that have these symptoms, and you're just trying to determine whether or not the headache is related to the C-spine or is it migraine type headache. So cervicogenic headaches or tension headaches tend to have very specific presentation and anatomy. They tend to be more dominant on one side, whereas a migraine is bilateral. Generally, they originate in the suboccipital region and can also be due to tension through the upper trapezius and levator scapulae muscles, for example, as well as the suboccipital muscles. Through C01 comes the greater occipital nerve. That nerve tends to run over the top of the head into the forehead and eye region. So that would be the presentation of irritation of that nerve. The lesser occipital nerve runs from C12, and that tends to run into the temple towards the jaw. So sometimes can explain temple and jaw pain that's related to headaches as well. One other differential diagnosis is what we would refer to as trigeminal facilitation. The trigeminal nerve nucleus is large. It runs all the way down to C23. So a lot of proprioceptive or nociceptive input from those upper cervical joints can facilitate or kind of agitate the trigeminal nerve fibers, and that will present as a referral to the jaw and potentially into the face. But basically, when I've diagnosed somebody with cervicogenic headache or of an origin from the cervical spine, I'm tending to take a look at upper cervical mobility, as well as postural factors. Those are the key things that I'm addressing. I'm going to try to improve thoracic extension, restore curvature of the cervical lordosis, reduce chin poke postures or forward head positioning, and improve mobility in rotation and flexion at the upper cervical spine. Restrictions in those areas are often reasons why tension develops in the suboccipital region in the first place. Many people that suffer from cervicogenic headaches have desk-type jobs, they're desk-bound, and they're in those types of postural positions for long periods of time, and slowly tension tends to build. I see that much more commonly than people who are in work-type positions and moving relatively frequently, changing positions frequently. So, address postural factors, take a look at upper cervical mobility. It can be definitely complemented by soft tissue release techniques of the suboccipitals, trapezius, levator scap, splenius type muscles, all of the cervical erectors, as well as potentially things like needling. They're all very complementary to trying to address cervicogenic headaches. Exercises should be based on restoring posture and mobility through that region as well. So in a nutshell, the anatomy and treatment of cervicogenic headache. For more information, please don't hesitate to check us out on smartpt.ca or Facebook.